Hello everybody, Med Made Easy here. Today we have a medication that we're going to talk about. It is an antibiotic and it is pronounced Metronidazole, which is also called Flagyl. So these are some informational tips that every healthcare provider should know and just general people who are taking this medication. Let's go ahead and begin. This medication is indicated and given for different things, including STDs, C-diff, and intestinal infections. These are just a few things. Let's go ahead and get into the tips. Tip number 1, do not take any alcohol within 72 hours before or after taking this medication. What can happen is the individual can start having some symptoms when those two are combined. They can have headaches, cramps, stomach pain, tachycardia, hypotension, and or nausea or vomiting. And this is just a few of these signs and symptoms. So the key takeaway point here is to make sure to ask your patient before starting the medication, and also to make sure that they understand that they're not to drink any alcohol while on this medication. Tip number 2, this medication can potentially raise liver enzymes. Now, it's not typical that the patient is always going to have a chemistry panel drawn just to check their liver enzymes, but if there's anything that you would suspect that the patient potentially could have some kind of liver disease or elevated liver enzymes, then obviously you'd want to go ahead and get a chemistry before starting this. A lot of times what would happen if the individual started developing some abdominal pain or jaundice or darkening of their urine, a lot of times getting liver enzymes might not be a bad idea. Info tip number 3, if a patient is being treated for an STD with this antibiotic, the sexual partner should also be treated as well. This is just an important info tip in general, and this can apply to many different types of antibiotics, especially if it's related to communicable diseases. Tip number 4, just let the patient know that they may develop a metallic taste in their mouth. It's nothing to be overly concerned about. It's something that can be a little bit annoying, but the patient may ask you where this is coming from, and at least you'll know it is from the Flagyl. Tip number 5, another side effect that the patient may develop is that their urine may turn a dark or reddish brown color. This is a common side effect, and it's nothing to be overly worried about. I do still think that patients should let providers know of these types of things, because sometimes there are other certain conditions that can cause the urine to be a color like this. Those are things to be aware of. So I think it is important for the patient to still notify the provider if that does happen, and then the provider can decide if they have any other questions that they want to ask the patient, and kind of go from there to decide what the next step would be, or if it's just something that they're not concerned about. Info tip number 6. Tell patient to report any neurological symptoms immediately. Because this antibiotic does penetrate the CSF, the cerebral spinal fluid, it can cause potentially neurological issues and side effects, and some of these can be very bad. Some things like seizures, peripheral neuropathy are just a few of the things that it can cause. So it's extremely important that the patient is educated about these signs and symptoms and what they need to report, and that they need to report it immediately. Well, that's it for this video, guys. Thank you so much for watching. Make sure to hit the like button if you like this kind of video. Also hit the subscribe and the notification bell so you can get the latest videos. And make sure to check out some of our other videos. Alright guys, until next time.